Hi, I'm going to do a presentation on the skull, the hyoid, and the ear bones. First, I'd like to talk about the skull. The skull is a cavity that protects the brain, and here we have sutures. The first one here is the coronal suture. Here, the middle part here, we have the sagittal suture. The back here is the lymphoid suture. We have the occipital bone right here, and then the parental bone, which is separated by the sagittal bone, and the frontal bone up here. We have the nasal bone, and in between the nasal bone we have the lacrimal bone. The nose has the vomer, the perpendicular plate, and then the inferior nasal concha. The mouth area, we have the maxillar bone. The mandible has a little hole here, which we call the mental foramen. When we open the skull, this little area here is called the ethmoid bone. The ethmoid bone has the cribriform plate, which contains the little holes called the olfactal foramen. And we have another pointy bone here called the crista gala. There's also another bone here that is called the sphenoid bone, and in here we have a hole that goes through the eye, which is called the carotid canal, and right down beside the carotid canal we have the jugular foramen. This big hole here is called the foramen magnum, and the occipital condyle is the side here of the foramen magnum. On this side we have, this side is called the mandibular condyle that fits into the mandibular fossa. We have the squamous suture on this side, and on the squamous suture we have the temporal bone over here. So basically that is all about the skull. The next is going to be the hyoid bone. We couldn't get the actual bone, so we drew, it's like a U shape that is located around the neck area, like the mid-neck area, and it's suspended and held by muscles, ligaments, and cartilage. It's the only bone that is not connected to any bone. And the parts, we have the greater horn on the tip here, and the middle here is the body or the lesser horn. The ear has 3 bones. We have 3 main bones here. We couldn't draw this one too. We couldn't get the actual bone, so we drew something here. It has 3 main bones. We have the malleus, which looks like a hammer, so it's also called hammer. The incus, which is that looks like an anvil, so it's anvil, and the stapes up here, and they both work together to transmit sound to the drum, the eardrum, that helps with the inner ear to also hear the sound. So that is all. Thank you.
Hi, my name is Carly, and I'll be doing the arms and the hands. So for the humerus, we have the head, and then the greater tubercle over here, and then the anatomical neck is here, and then the surgical neck, and then down at the bottom we have on this side the olecranon fossa, the lateral epicondyle, the trochlea right here, and then the medial anacondyles over here. And then if we do it posterior, we have the head, the greater tubercle, and then the inner tubercle is right here. And then down here we have the deltoid tuberosity, and then we have the trochlea is on this side now, right here, and then the medial is on right here, and the capitulum is right here. And then I forgot to mention that the hole, which is what I was looking for, on the other side is the nutrient forum, which you might be able to see anyway. And then moving on, we have our radius, and this is the anterior. This side's the anterior, and then we have the head, the neck, and then the rough spot here is the radia tuberosity, and then we have the styloid process down here. And then posterior, we just have the head, the neck, and the styloid process. And then for the ulna, we have anterior. So this right here is the trochlear notch. And then we have the coronoid process and the ulnar tuberosity. And then down here we just have the head and the styloid process right there. And then anterior, we have the cranion and the styloid process. And then they just fit in here like that. And then moving on, we have our hand, which we just have our phalanges, which are up here, the metacarpals here, and then the carpals, which are down here. And that is it for arms and hands.
Alright, so my name is Christina, and this bone right here is your clavicle. So this is also known as your collarbone. This part right here is the sternal end, and then this right here is the acromial end. Next, we have our scapula, which goes right back here. This part right here is the medial end. This is the lateral end. This right here is the subscapular fossa. This right here is the glenoid fossa. This right here is the spine of the scapula. This is the supraspinous fossa. This is the infraspinous fossa. This is the acromion process. And this right here is the coracoid process. Next, we have the ribs and the sternum. We did not have an actual sternum. Ours was a little broken, so I drew a picture. This right here is the clavicle on each side. This is the sternum. This part right here is the manubrium. This is the body, and then this pointy part down here is the xiphoid process. And then here is, it doesn't have the actual ribs on it, but it does show the vertebrae. So this up here is the cervical vertebrae. This is the thoracic vertebrae. This is the lumbar vertebrae. And then we also have the sacrum down here, and then the coccyx down here. And then each particular vertebrae, so this is an example of the cervical vertebrae. This down here is the spinous process. This is the vertebral foramen. This is the body. And then this is called the Ars. This is an example of the thoracic vertebrae. So this down here is the spinous process. This is the transverse process. This here is the vertebral foramen. This is the, I can't read what it says. Oh, the laminae. And then on the other side is the pedicles. And the next one is the lumbar vertebrae. So this is the body here. This is the spinous process. This is the vertebral foramen. This is the lamina. These are the transverse process. These are the articular process. And then for the ribs. So these are just an example of two of the ribs that we have. And then there are true ribs, which are the ribs at the top, 1 through 7. The false ribs are numbers 8 through 12, and the rest are called floating ribs. And they are all connected. The true ribs are connected to the sternum by costal cartilage. And then this is the head of the rib. This is the neck. This is the tubercle, and then this is the sternal end here. And then lastly, I have the pelvis. Okay, so I'm going to talk about the pubic bones now. So the pelvic arch is the arch that forms when the two bones come together. The symphysis pubis is the joint that connects the left and right pelvic bones. And then each pelvic bone, this is the ilium, this is the ischium, and then this down here is the pubis. This is the iliac crest. This over here is the posterior superior spine. This down here is the posterior inferior spine. This is the greater sciatic notch. This down here is the spine of the ischium. This is the ischial tuberosity. Down here is the ramus of the ischium. This here, this hole is the oblurator foramen. This up here is the inferior ramus of the pubis. This over here is the pubic tubercle. This right here is the pelvic crest. And then this right here is the superior ramus of the pubis. This is where the femur attaches to, and it's the acetabellum. And then this right here is the anterior inferior spine. And then this right here is the anterior superior spine. And that's it for the pelvic bone.
All right, now here we are with the legs. It's gonna start off with, this bone is the femur. It's gonna go right in your thigh and connects right to your pelvis. So it connects through this part, which is the head, and it's connected to the main bone by this little neck that sticks out. Although you will notice this little hole here, that is the fovea capitis. Then turn around these little things here. This is the greater trochanter, and then this here is the lesser trochanter.
Oh, that's the eye one.
Going down here, this long part is the shaft, and this little bump line that goes all the way down the shaft, that's going to be the linea aspera. And then if we go down to the bottom, we have the lateral condyle and the medial condyle on the lateral and medial side down here at the bottom. That's going to connect to this next little thing, the patella. It's very small. This is the kneecap. It just kind of goes right on there. Or here. And then, because at the bottom, there's this fibula. And so the fibula and femur are gonna connect, and then the patella. Gotta hold this all. We'll just go right in the middle here. Moving on to the tibia. We got this thing here. This is the tibial tuberosity. And all the way at the top here, this is called the intercondyle eminence because it's so big and bulky. And then at the bottom, this is the medial malleus, little notch here. It's called that because it's right next to the lateral malleus on this bone, the fibula. They connect together, medial malleus, lateral malleus. And then last but not least, we got the foot. These are going to be the tarsals back here, including the calcaneus and the talus in the heel to connect to the actual leg with the tibia, and then ankles. This is the talus, tarsals. These are the tarsals. And then we got the metatarsals here for your actual foot, and the phalanges, which are your toes. And then just to wrap things up, the overall purpose of all of these bones in the skeletal system is to help provide some structural support, help your muscles move around, and also to offer some protection as just a solid surface. And there you go.